Hello, I am Dr. Naga Srinivas, Senior Consultant Cardiologist, Manipal Hospital, Whitefield. There are two kinds of risk factors for the heart attack. One is called a modifiable risk factor and the other one is a non-modifiable risk factor. The modifiable risk factors are high blood cholesterol, high blood pressure, diabetes mellitus, smoking, sedentary lifestyle. The non-modifiable risk factors are advancing age and the male gender. So these heart attacks can be prevented by introducing what is known as healthy lifestyles or lifestyle modifications. The complications of the heart attack can be broadly divided into one, mechanical complications, and other one is the electrical complications. The mechanical complications, the most common and the deadliest one is the heart failure or the pump dysfunction, we call it as. And the electrical complication, we broadly divided it to ventricular arrhythmias or sometimes the heart blocks. So once the patient reaches the hospital with a heart attack, we give a couple of medications which were referred to as the blood thinners. The tablets, we call it as antiplatelet agents, heparin and high-dose statins. Usually after a heart attack, the patient can go back to the work within 4 to 6 weeks. That's the time during which whatever the damage to the heart was there, that gets healed up. So you can resume the physical activity after 4 to 6 weeks. If there is any family history of heart disease, you need to start looking at your heart from the age of 35 years onwards. The routine investigations to look at your heart are number one is a complete lipid panel, fasting blood sugar, postprandial blood sugar and HbA1c, and then sometimes we may require to do what is known as a CT coronary angiogram with a calcium score. Sometimes there will be a family history of coronary artery disease. In such cases, the offsprings of the individuals who are having a coronary artery disease can have heart attacks. Yes, once the damage to the muscle happens, it is difficult to regain the muscle back. So whatever the damage happens, it is irreversible. Yes, birth control pills plus smoking increases the risk of heart diseases in young women before menopause. Following heart attack, you need to change your diet pattern. Mostly the diet should contain more amount of protein, moderate amount of fat and less amount of carbohydrate. You need to take more amount of vegetable diet, more amount of fiber and pulses. As soon as you quit smoking, the risk of heart attack usually comes down and the risk will become completely to the non-smoker levels within 3 to 5 years after quitting smoking. Primary angioplasty is a life-saving procedure or a life-saving operation. We do it when the patient has a heart attack. So basically what we do in primary angioplasty is we pass a balloon across the blockage within the coronary artery or the artery which is supplying to the heart and inflate the balloon so that the block gets compressed against the walls of the artery and the free flow of blood is re-established. Basically angioplasty means it's a removal of the blockage. It's an endoluminal treatment or an endovascular treatment wherein we pass a balloon across the block and inflate the balloon so that the atheromatous block is compressed against the walls of the artery. This will establish the flow across the vessel. Whereas in bypass surgery, we create an alternative route to the flow of blood. The block remains the same, but whereas the blood will be bypassed across the block through another channel or an alternative channel. The indications for the angioplasty and the indications for surgery are totally different. If the blockage is focal, then we do the angioplasty stenting. If the blockage is diffuse and it involves more than 2 vessels or more than 3 vessels, particularly in the critical areas, then we suggest bypass surgery. Basically in angioplasty stenting, we pass a fine wire across the blockage. On this wire, we thread a small balloon, and this balloon will be inflated. This inflation causes the plaque to be compressed against the wall of the artery. To prevent the vessel to recoil, we implant what is known as a small metallic mesh known as a stent, which is a metallic scaffold. So this will ensure the artery to be patent widely at the end of the procedure. Usually this procedure is not associated with a very great risk. The success rate of this procedure is usually 98%. There is a small 1 to 2% risk is involved in this procedure. The tests done before angioplasty procedure are the routine, the blood investigations like the creatinine, the blood sugar, the hemoglobin, and the platelet counts. And we also check the heart function with the help of an echocardiography, and ECG also will be taken just before the angioplasty procedure. So on the day of the procedure, what we do is we do prepare the parts. Basically, the angioplasty can be done from the hand route, from the wrist route, we call it as the radial angioplasty, or it can be also approached from the groin route. So what we routinely do is we prepare both the groins and as well as the right arm, and we try to secure one IV cannula, a large bore IV cannula to the left arm, and then we do all the preparation and we give routinely the drugs like called the blood thinners, heparin and the statins before doing the procedure, and then shift to the cath lab. The total duration of the procedure will be lasting for around 45 minutes to 1 hour, and once if the procedure is uncomplicated, the patient can be discharged or go home in the next day. Post angioplasty, the patient can attend to his duties. If it is uncomplicated, it can attend to his duties within 1 to 2 weeks. The only precaution to be taken following the angioplasty procedure is try to avoid doing kind of strenuous activities in the form of lifting weights, etc. And routine household activities can be performed like taking bath and taking a stroll in the house. All these things can be done perfectly. And we need to introduce what is known as the lifestyle modifications as early as possible following the procedure. These lifestyle modifications include the routine physical activity and then instituting healthy eating habits in the form of a good amount of protein diet, a moderate amount of healthy fats, and less amount of carbohydrates. Following angioplasty stenting, one has to be on the regular medications for at least 1 year. There are two kinds of medications which we'll be giving, which are very important in maintaining the patency of the stent. One is they are called the antiplatelet drugs. One is aspirin and other one is ticagrelor or clopidogrel. These two drugs, along with statins and other beta blockers, they should be continued for at least 1 year. Premature cessation of blood thinners can again result in recurrent heart attacks. So one has to be very careful not to miss at least even one dose also. So the medications to be taken following angioplasty stenting are, one is aspirin and clopidogrel or ticagrelor along with statins and beta blockers. So these medicines are to be taken for at least a period of 1 year post angioplasty stenting. Thereafter, depending upon the bleeding risks and other things, we can reduce the dosage of the drugs, or we can reduce the number of the drugs. Basically, we have to remember one thing, that is a coronary atherosclerosis. It's a diffuse process. It can affect each and every blood vessel in the body. So, an angioplasty stenting or a bypass surgery, it's only a palliative kind of a procedure. It's a focal treatment for a systemic disease. So, the most important thing is you need to take care of your lifestyles and regular usage of medicines to control the blood pressure, blood sugar and blood cholesterol.